Okay, so you're spending some time, you're doing a lot of work at home or at the office now, and you're getting some lower back pain. Most likely you're doing this for more than an hour or so. And now you're feeling it here. Now, biggest thing is if you're getting a lot of back pain, you got to look out for a couple things. You get numbness down your legs. You get any severe pain. From a scale of 0 to 10, you really need to be a good judge of that. Things like those, you really need and should consult a healthcare provider, whether it's a chiropractor like me or a physical therapist or a medical doctor. You want to know your options here, okay? But again, you want to go with a conservative approach. A couple things you can start doing though to help you with your aggravation. If you are seated and you're getting a lot of lower back pain, probably 70 to 80% of the time it's because of the fact that you're always seated forward this way, maybe bending down this way, which is definitely not a really safe move at this point, especially if you're hurting your back. What you could start doing are some extension type exercises, all based off what we call a McKenzie protocol. All right. So a couple things you can start doing. First of all, make sure you stand up. Make sure you give yourself some time every time throughout the day to give yourself a break. Again, 30 minutes or 45 minutes or so. When you're taking that break, you're going to stand up. If your back is hurting, get your hands on the small of your spine. Okay. And you're just going to go easily and just very simply bend back to where you can tolerate. Then straighten yourself up to a nice neutral spine again. Then back, then up, okay? This is a very simple exercise, but a very powerful one because it does help relieve a lot of back pain for a lot of disc patients like that I see every so often. It does help relieve some of the symptoms that may be going down, traveling down the leg. So again, up to where you can tolerate. It doesn't have to go all the way back. If it's something where you're comfortable with, even a small amount of degree, that's okay. Then straighten yourself up, okay? Back and up. And I usually prescribe maybe a set of 10, just at the beginning, sometimes 3 sets of 10, typically in the office, just as we're working with patients with this. Now, if you're noticing pain traveling down the leg and it's getting more intensified, I'd like you to stop. You definitely might need to consult a healthcare provider there at that point, okay? Again, these are some things that you could start doing on your own. Again, about roughly 70–80%, this does help with a lot of lower back issues. Any other questions? Definitely consult with a healthcare provider, consult with a chiropractor like myself or a physical therapist. They all definitely be able to help you with many different approaches. Again, conservative care is one of the first primary thing you need to do first before any types of medication. If you need to, you can definitely look me up at HaroldSquareChiropractic.com. Thanks again.